Okay, so today we're going to start off with the coxa, which actually gets divided into three regions. You have your ilium, which is this part right here and up. You have your pubis region, which is from here down. And then you have your ischium or ischium, however you want to pronounce it, which is from here to here. For your ilium, we're going to start off with your iliac fossa, which is this one right here. It's on the anterior version. And then on the posterior surface, you have your gluteal surface. Then you're going to have your iliac crest, which is at the very top. Then you have your anterior superior iliac spine, your anterior inferior iliac spine, and then your posterior part would be this one right here, which is your posterior superior iliac spine, your posterior inferior iliac spine. After this, we have the greater sciatic notch, which is right here, and your auricular surface, which as you can see kind of looks like a little peanut. Moving on to the ischium, we're going to have the ischial spine, which is right here. It's right under the greater sciatic notch. And then we have the lesser sciatic notch, which is this little rounded area right here. For the ischial tuberosity, it's actually going to be on the posterior side, which is this part right here. It's kind of like rugged. Moving on to the pubis, we have the pubic tubercle, which is right here. The pubic crest you actually can't see because it's going to be kind of the cartilage region of it. Then, however, for the superior pubic ramus, it's going to be this one right here, and then you have the inferior pubic ramus. So that kind of covers the whole coxa. Alright, so now we're going to talk about the differences between the coxa in male and in female. For male, it's actually going to be a little bit longer and narrower. However, for women, it's going to be broader and it's going to have a more of an oval shape overall. And that's kind of like the main differences in between the males and the females. Okay, so today we're going to go over the femur. We're going to start off with the fovea capitis, which is this little indentation right here at the head of the femur. The head of the femur would be considered this. The head of the femur is the surrounding part of it. After this, we have the greater trochanter, which you can see on the posterior side of it. It's this region right here. And then you have your lesser trochanter, which is this one right here. For the linea aspera, it's going to be this inferior region at the very bottom. Then you're going to have your medial and lateral condyles, which are these little parts right here. This is considered the medial condyle and then the lateral condyle. For the medial and lateral epicondyles, they're more on the superior side of it, which is over here. This one's going to be your lateral epicondyle and then your medial epicondyle. After this, we're going to have your intercondylar fossa, which is right here between your condyles. And then you're going to have your patellar surface, which is actually on your anterior side, and it's considered this part right here. After that, we're going to move on to the gluteal tuberosity, which is actually on the posterior side as well, and it's this little rugged line as right here. After this, you have the intertrochanteric line, which is on the anterior side, and it's this one right here. Then we have the intertrochanteric crest, which is this region right here.
I'm doing the patellae, the tibia, fibula, and the feet of the lower limbs. Here we have the patella. Here we have the base and the apex of the patella. We have the lateral facet and the medial facet. And you can tell this is a lateral facet because the lateral facet lays down on the surface, and then you can tell right from left because of the direction it points towards. So since it points towards the right, this is the right kneecap. Right patella or kneecap. And then here we have the fibula, and I like to kind of put it together. You can tell that Alright, you can tell that this is the head of the fibula and this is a lateral malleolus. And then right here, this is the tibia and this is the fibular notch because that's where it connects to that's where the tibia and the fibula connect. And then here we have the intercondylar eminence. We have the lateral condylar, the medial condyle and the lateral condyle, and then we have the tibial tuberosity, and then right here we have the medial malleolus. And for the fibula, you're not gonna know left from right because it's just random. But you're able to tell that this from your left from right tibia because it's the medial malleolus. If the medial malleolus is on the right side, then it's medial to your body. So it's the right. It's on the right side of your body. So wherever the medial malleus is, it determines what side of the body is on. And then we have the foot. For the foot, you have your tarsals, and then the acronym or something that you can use to remember each tarsal bone is tiger cubs need MILC. Tiger cubs need milk. This is talus, calcaneus, navicular, medial cuneiform, intermedial cuneiform, and then lateral cuneiform, and then cuboid. And then here you have your phalanges, and then number 1 through 5, proximal to distal.